Uganda's remote Karamoja region is known for its unique and arid landscape, traditional cultural practices, and tough living conditions. After years of armed conflict and insecurity in the region, Karamojans were left living in chronic poverty with food shortages and malnutrition, all worsened by frequent droughts. Peace is now prevailing and has resulted in rapid changes, including population movements and expanding economic developments. But consequently, a rise in HIV infections, especially among youth.
Very many different tribes are now here. We're having the Gishu, the Etesos, the Acholis, the Karamojans, the Upe, even people of Kenya are here. The Congolese are here. Now, if you check on that combination, we cannot miss high spread of HIV.
While the region's HIV rates have been significantly lower than the national average, limited access to quality health services, paired with stigma, high rates of alcohol consumption, and youth unemployment are still high risk factors that could lead to an increasing number in new HIV infections.
Between 2005, 2011 and 2016, we saw the HIV prevalence double. So despite having a low HIV prevalence compared to the national average, there has been a rapid rise.
Contributing with $10 million, the Embassy of Ireland has been a key player in the fight against HIV in the Karamoja region.
Having visited Karamoja on several occasions, it is a particularly unique and actually quite beautiful area with extreme challenges. The element of Ireland has been working there for a long time, and we have prioritised our work there. And one of the issues that we saw there was at that time the prevalence in terms of HIV.
In 2016, the government of Uganda, together with the Embassy of Ireland and the United Nations in Uganda, came together as KARUNA, the Karamoja United Nations HIV program, delivering as one to reduce new HIV infections amongst youth in Karamoja. Using a holistic multisectoral approach built on past achievements and partnerships, the 5-year KARUNA program set out to achieve 3 main objectives: scale up coverage, utilization, and access to sexual reproductive health and HIV services, address social, cultural, and economic barriers, and strengthen the national and regional capacity, planning, and information systems.
The program in Karamoja was beyond health, was the beginning point, and it focused on other aspects of adolescents and young people that affect their health. It looked at education, it looked at nutrition, it looked at livelihoods, it looked at socioeconomic empowerment, it looked at social-cultural barriers, it looked at employment, gender-based violence. The entire UN came to address this issue, and they did so in one of the most important multisectoral approach in collaboration with the government leadership.
Working through implementing partners, strategic interventions have focused on bringing integrated health services closer to the communities, offering immediate access to a wide range of services, including maternal and child health care, immunization, malaria and HIV testing and treatment, and nutrition services.
We are able to see that many people are coming for the services because they are closer to them. We are bringing the services closer to them. But also at the same time, being that when we are interacting with them at the facility, at the community level, when we give them the follow-on kind of information, they are able to come to the facility for the next services. So somehow we are seeing that the health-seeking behavior is improving among the community members.
However, this year, COVID-19 presented unexpected challenges as health centers saw fewer people coming for HIV services and treatment.
People were thinking that the COVID is in the health centers because this also started putting on masks, and so they knew, I think this is the breeding place for COVID. We saw a decline in the number of our clients. We were able to see that people are not coming for the refills, and thanks to the partners again, we were able to follow them using the expert clients, and we were able to bring them back.
As part of existing community structures, expert clients and peer mothers have been crucial in addressing stigma and retention by identifying, sensitizing, supporting, and following up on people living with HIV in the privacy of their homes.
When you talk about HIV, you find there's a lot of fear. You don't want to talk openly about HIV. So that aspect of knowledge is still a big problem for us in the Karamoja region, considering the fact that most of our youth at home, they are not in school like other regions.
Reaching out to the masses, radio shows have proven to be very successful in creating awareness around sexual reproductive health and HIV, while lowering barriers of stigma and promoting positive living and healthy lifestyles.
The message we are giving them is there is need for them to know which foods to eat, so that their bodies are strong, their immune system is built and made strong to fight HIV/AIDS. Though you can't be cured, but at least your immune system can fight the virus and you can stay long.
In the urban communities, condom distribution points at hotspots, such as bars and video halls, are regularly topped up by respected community leaders, together with messaging on how to use them. With Karamoja's deeply rooted cultural values in mind, elders, who are the most influential and respected leaders within society, have been integrated into the KARUNA communication strategy.
My work as an elder, just to guide people with their life. But the problem now, the alcohol. Too much people that are taking these younger people from the age of 18 up to 35 years.
Through community influences as well as peer-to-peer education through youth groups, health messages are now reaching deep into villages and changing perceptions and perspectives of Karamoja's youth.
I used to think people with HIV are prostitutes, but now I know anyone can contact HIV, even me.
In the past, we used to think that people living with HIV, that if they eat the meat of the dog, they can be cured. But nowadays, it is the ARVs which can improve them to live long.
Before, we had a belief that anybody who has HIV should not share with you like a plate of food. But if you're to look at the current situation, we can share food, you can share together, not like those days.
Another key area of the KARUNA program has been addressing economic empowerment in the Karamoja region, especially for women and youth. During the UN Resident Coordinator's visit to Karamoja earlier this year, Rosa Malango re-emphasized this critical aspect.
When we went to see the skilling of youth, people living with HIV, that was a good example of what you can do to take people out of poverty. As you know, the UN has done a socioeconomic analysis, and we noticed that mostly women and youth are the most affected, especially those working in the informal sector. So anything that can be done in terms of skilling, empowerment for them to be able to be part of the economic recovery is critical. And I think that what we saw this morning is a very good foundation that can be scaled up and invested upon.
Through improved coordination structures at regional and national level, KARUNA's multisectoral approach has strengthened visibility of HIV reporting and accountability beyond the Karamoja region.
KARUNA was not just a Karamoja program, it also had a national component. That national component needs to be recognized. It really built on programs like the NASA, the National AIDS Spending Assessment. It really strengthened the visibility of HIV and reporting and accountability at the national level. And also it led a lot around domestic financing. And that is truly the multisectoral approach. Not just the multisectoral approach in Karamoja, but now the multisectoral approach that will affect and influence the entire programming in Uganda.
This whole range of interventions, both public health, but also non-public health interventions that were addressing underlying drivers were really key. And when we look at the results, we've not done a full analysis yet for us to see the outcomes, but it's clear that we see a reduction in new HIV infections. We see an increased enrollment, on ART programs. I have no doubt that this program has impacted and will change the lives of the people of Karamoja.
And the success of this holistic approach shows. After 5 years, KARUNA has reached and improved the lives of adolescent and youth living with HIV across 9 districts in the Karamoja region and can register a significant 17% decline in new infections amongst youth.
You're looking at over 200,000 young people who have been impacted by this program. And it's not just in terms of treatment, which is critical, and it means, but it's behaviour. And this issue, especially with the younger population, that behavioural message is key. So it has had impact, and we're very proud of that impact that it has.
Karamoja is not being left behind. Everywhere I went, everybody's like, please make sure Karamoja is not left behind. I can tell you it's not being left behind. I heard innovation, I heard determination, and I heard solutions. And I think that now we need to change the narrative about Karamoja and start talking about investing in Karamoja and scaling up tourism, scaling up the minerals industry, and scaling up. I saw soap being done, all these things. Let's scale that up so that the youth can have a job and the quality of life people can improve.
As KARUNA comes to an end, the fight continues, paving the way for the global goal to end HIV/AIDS by 2030.